Hi, everybody. I'm Hoppy Kercheval. I'm here with Missy Bazzo, Director of Medicare from Peak Advantage. And today we're talking about Medicare enrollment periods to help educate you on the different times throughout the year that you may enroll into a Medicare Advantage plan. These are very key dates and months to remember to ensure that you are making choices during the right time of the year. So, Missy, let's get started. I got to tell you, this is a little confusing, okay? There are a lot of
Sure.
different enrollment times. So what are the main enrollment periods we need to know about?
So there's four of them.
Okay.
Four. There's IEP, AEP, SEP, and OEP.
All right, let's break that down.
Yeah, for sure.
Start with the IEP, the initial enrollment period, which I think most people are familiar with.
Sure. So this is the one that basically is the grand start of everything, right? So this is for anybody, who is just turning 65, and there's that 7-month time frame where people can look into joining into their Part A and B along with a health plan, either 3 months before, during, or 3 months after their birthday month. And so this is something that, if you do have further questions, don't hesitate to reach out to us and we can help you guide around those certain timelines.
But to dig a little deeper there, what does that mean for a potential or upcoming member?
So what this means is that this is their first time enrolling into the Medicare Part A and B. So you want to ensure that you are doing this so that you don't encounter certain like penalty costs, because there's certain timeframes and guidelines. And this just isn't here with Peak. This is a national, type of check mark list of timeframes.
And that's why you have to stay within those dates, right?
Correct.
Okay, I understand.
Yes.
All right, let's go to AEP, annual enrollment period. What's this time frame and how's that different?
So this is that time frame where this is like the red carpet moment, right? So between October 15th and December 7th, this is the time frame where people can look at their health plan that they currently have, what changes are coming about, and possibly if they either want to stay with their plan or if they would like to switch to another plan.
Okay, so this is you're already enrolled, right? But you want to see if, what it's going to be for the next year.
Correct.
Okay,
Yes.
all right. And so what's that mean for our members at Peak?
So regarding with the AEP though, this is that if they join during those timeframes, again, October 15th through December 7th, the benefits then would start on January 1st that following year.
Okay.
So that's why it's so important that, again, this is your time to check and really make your choices that's best for you around cost, your certain healthcare background, just anything of what's important to you. Because not everybody is the same, with their health. So dental may be more important to another person, vision, hearing, their prescriptions. So, really just deep dive a little bit further. This is your time to really make sure that you're making that proper choice for you.
So let's go to OEP.
Yes.
What is that?
So that stands for open enrollment period. And this is the time frame where it's January 1st until the end of March. So this is where during that AEP time frame that maybe somebody, maybe is just kind of hesitant or they feel like they didn't make the right choice. So they're able to switch back to another Advantage plan. So this is just something that, they're able one more change if they would like to in between those 3 months up until the 31st of March.
I think that's really important. Maybe the least known about that you still have an option there.
Correct.
Right?
Yes. So, and that's we're in the heart of that now, right?
Yeah.
So that's the reason why it's just so important, because people don't know and they feel like sometimes they're stuck and they're not. But again, if anybody ever has like a question like, am I stuck? Am I able to move? Am I able to change over? Please reach out to us because we have the experts that can for sure help you.
So when does the coverage start though in that enrollment period?
So that's always starting the first of the month that following month. So if somebody was to change with us, it's March 2nd right now, right? So if somebody was to change with us, then their benefit would start on April 1st.
Okay. Then there's one more, a special enrollment period. And what is that?
So that's the SEP timeframe. And this is something that's basically, it's more or less year round. Some people will say it starts on April 1st until the end of the year. But this is for somebody, who is just getting on to the card of Part A and B, because, people, regardless of age, can get onto this just as long as they have the Part A and B, or if they just moved into the area, or if they lost their coverage through a employer, if they retired, so there's all those extra type of life
Like life changes that occur. Yeah.
that are going on that will kind of create, and that's what creates the SEP.
So you've done a really good job explaining this, but I want to be honest, it's a little confusing about all these different enrollment periods. So we went through them pretty quickly. What if you have more questions? Like, I need to find out more about these things. How can you find out more?
Yeah, so we have a solid team internally. So please call our customer service, right? Or you can actually go onto our website, peakhealth.org, and they can help guide you around these timelines. And then also too, if you are needing help further, we have our internal call center, but also we have wonderful expertise agents that are out in the field that are licensed and certified to help you as well.
And they can walk you through this and also explain the pros and cons. And like the term I'd like to use is walk you through it, because it gets a little, I struggled a little bit until I got somebody to walk me through it.
Correct. And so that's a agent who helped you, Hoppy, and that's the same thing. So we have a full team of agents, over 500 just in this state that can help you.
That'd be great. All right. Thanks, Missy. Thank you for helping us understand and explain these very important enrollment periods. And if you need further help, please reach out, as Missy said, to Member Services at 855, that's 1-855-962-7325, or visit our website at peakhealth.org. And thank you for being a valued member of Peak Medicare Advantage, just like me.